We're all by now familiar with many of the ways we can help protect ourselves and prevent others from contracting COVID-19. Physical distancing, face masks or coverings, cleaning surfaces, washing hands, getting tested and self-isolating. But we now know that an additional and a crucial protection is good ventilation. And by that we mean taking measures to increase the amount of outside air that is entering a building. It's important to pay attention to good ventilation in our own homes by opening windows, doors or vents, but equally to know what can be done to improve ventilation in our workplaces. Now the masks, washing, cleaning, distancing that we've all become used to, they help protect against the larger droplets containing the virus, the droplets that we release through coughing, sneezing, singing. But they're not enough to deal with aerosol spread, the much tinier droplets that we all create just when we're breathing. We now understand that coronavirus is in the air. It spreads like smoke in tiny aerosol particles exhaled by infected individuals with every breath. So ventilation is key to prevention. In workplaces, virus concentrations can build up in indoor areas that are poorly ventilated, where workers breathe shared air for hours at a time. That's why the risk of contracting the virus indoors is so much more likely than being outdoors, where fresh air disperses the particles more quickly. In fact, the risk of breathing in COVID-19 is 20 times higher indoors than it is outside. The most important element of good ventilation is to maximise the amount of fresh air coming into the premises. Effective ventilation, it removes stale air and it brings in cooler, drier air, which, not to get too technical about it, but it contains more oxygen, less carbon dioxide, CO2 and water vapour, and also fewer microbes. Now there's lots of information out there, and we'll put links to Scottish Government guidance and a great article in Hazards magazine into the video description. But just to give you an outline of some things that will help. Your employer should be avoiding using parts of the workplace that are poorly ventilated. And so ideally, CO2 monitors should be used to work out how good ventilation is. Indoor air at 600 to 800 parts per million carbon dioxide indicates a relatively well ventilated room. Over 1500 parts per million means very poor ventilation. And levels above 800 parts per million, well, they should be investigated. It would be important for your employer to take advice about the effectiveness and the proper use of these monitors, but once it's known what levels are, it makes it easier to look at what other controls might be needed. Things like reducing the number of people in a space, as well as reducing the amount of time people are in the space. Wearing masks reduces the spread of both the bigger and the smaller aerosol droplets. Talking creates more aerosols, so if there are ways that the need for talking can be reduced, especially reducing the need to shout to be heard by colleagues, then that will all be beneficial. Thought needs to be given to how to increase airflow, but recirculating air, that should be avoided. So while desk or ceiling fans can be used to increase airflow, that needs to be done carefully so it's not just recirculating contaminated air. It's an area on which external advice may well be useful, as will also be the case about the effectiveness and the proper use of air filters or air cleaning devices. So what can you do at work? What are the key things to look out for and ask about? Well, remember, employers must by law ensure an adequate supply of fresh air in the workplace. Aerosol transmission, it should be considered in your employer's COVID-19 risk assessment. So ask to see it and question it if it's insufficient. Have you or your safety reps been consulted about the COVID-19 risk assessments? Because you should have been. Find out about your workplace ventilation system. Your employer should provide your safety reps, and if there are none, they should provide you with information about it. If they haven't, then again, ask. Does the system depend on opening windows and vents? If so, who monitors that? How is this impacting on your work environment in other ways? So maybe increased noise and pollution, or else decreased temperatures? If it's a mechanical system, is it maximising the amount of outside air being brought into the workplace? Is it providing the recommended airflow? And a way of measuring this is monitoring the number of air changes per hour. Is it maintained properly? Are the correct filters in use? And are they replaced and maintained frequently? Ask for monitoring and maintenance data, including CO2 levels. And, consider whether occupancy levels are being reduced as far as possible. Are rooms left empty after use to let aerosols dissipate? And are the premises regularly cleaned? You and your colleagues, and your union, if there is one in your workplace, you can achieve change here. The Union Unite claimed an important victory when it was announced that London buses had been fitted with an improved, safer air conditioning system. All London buses now have systems which ensure that the air entering the driver's sealed cab comes directly from the outside. It doesn't pass through the passenger area of the bus. Please remember, if you don't feel able to raise these issues in your workplace, if you haven't been given the information that you need, or maybe you need a bit of help actually making sense of the information that you have been able to get hold of, then we're here to help. Give us a call on 0800 0015 022 or drop us an email to info@scottishhazards.org. All of our advice is free and it's confidential. Together, let's stop this pandemic at work.